I could be wrong. Is that too tall? I don't think it will be. Good job. And now put your hand. Yeah, see, I think it's just a little easier for you, Linda. See, if I took the stool away, you'd be closer to the ground. And now you're going to be pulling more that way. Now you're pulling more horizontally.
Okay.
Now let's talk about this. Perfect. Is she off the humeral head, Carrie? What else could you tell her? I see one last thing, and I think we got you. What else could you tell her? I would take your hand and envelop the chest more like that. Do you follow me? Mm-hmm. I take your there. Now you got the. Does that feel, Carrie, better?
Yep.
So you got the
nice
chest. You got this. You got the entire chest.
Okay.
Do you feel that? And the coughing part is a good sign. We're going to talk about that right when we get done here. So that you have. This you have. Here we go. Breathe in. You're really good on your technique. In other words, and Carrie, the only thing is, she's in control of you, so she's going to say pause. You got to kind of wait for her, and you're going to say, okay, hold. She's going to choke a little bit, and listen to Linda.
And breathe in. That's it. And let it out.
Nice. Good job. Now I'm going to stop both of you. Carrie, give her some input. How did that feel?
It feels good.
Did it feel similar to what I was doing? Pretty close, wasn't it? I think you did a great job. One of the things I like what you did is you even let up when you thought you needed to let up. Do you follow me? In other words, sometimes if you hold it down too much, you're going to treat a shoulder. Mm-hmm. So you just took the slack up without over pulling. And then once and you can allow her to go because it's still stimulation. You're still getting it in.
Yes.
Do you follow me?
Yes.
But again, her first rib is
come with her with
exactly.
the left hand.
And her first rib is moving, so you don't have to get aggressive at all. And you follow me? If it wasn't moving, you'd have to get a little bit more aggressive, but you don't have to on her. Okay. Do you feel the need to choke? Do you feel the need to cough? I mean, isn't that cool? I'll talk to you about that. Okay, we're going to flip gears. Do you mind, Linda, laying down and having her practice on you? So let's go ahead and put your top on. Let's not worry about treating her. Let's worry about practice. Don't worry about a thing. I just want you to practice. I think we should do the same thing. Do you mind? Yep. I just want you to show me this technique, and then we're going to go right into that technique. Okay? And I know you've already done this with somebody, but I just want you to go ahead. Actually, all I want to do is just start off with, just with a good this, and then we'll go, because it'll be a safer thing to do. Okay?
So you want me to do that?
The superior T4 technique. So just what she did to you, I want you to do the same thing she did to you. There. And I'm going to, I should let you do it, but I just want there. And I'm going to do this there.
Okay.
Do you see that? I just want to make sure. And this thumb I move over here on her. There.
Okay. Like that?
There. She's covered. There.
Okay.
Nicely done. Everything's covered up. There. You got her. Thank you. Whew. Linda, thank you. Here we go. You ready? You are now touching. She takes a breath of air in. And blow. There. And, Carrie, two people could help you, but you got that technique down right there. Pause. Breathe in. That was it. Because if you pull any further than that, you're going to leave the patient.
Okay.
Do you follow me? So you may not get as much in here, but you're doing it right. There, and I'm going to take my hand off. You're in the perfect position. I would then just tell you, I would get
off the
clavicle. There. Now you're even in a better position. Does that feel, Linda, better right there?
Breathe
now
in.
you're
A little bit on the humeral head, I think.
Okay. Good put.
There you
Good.
go.
There. Thank you, Linda. So sometimes these thumbs will cross over because she's got a little chest here. You know what I mean? It's not. It's in. Do you follow me? It's not. It's not moving out. But now, Linda, does she have you?
Yeah.
Okay.
Say, breathe in.
Beautiful. 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 Good. Nice work. Hold. Good. I'm going to double check something here. Doing a good job. Oh, good. Okay. Perfect, Carrie. Your elbows are bent, your body's good, you're on your left leg, you're doing a great job. And Linda, I don't think I could do much more than that, to be honest with you. Do you follow me, Linda? We're just using your body, okay? Tell us, did it feel like she was in control, at least of the breathing?
Yes.
Okay. This hand was in pretty good position.
Yep.
The only comment I would make is maybe you could have taken your hand and gone a little bit more like that. Yeah. But other than that, I thought you did really good. And I know you've practiced that already. Could you come on over? You don't need that stool. See, you're about my, you don't need that stool. I don't believe you do.
No.
So let's practice this, okay? And talk your way through this. Could you just talk your way through it? And why don't we first of all get her closer to you?
Come closer towards me.
Scoot over there a little bit. Perfect. Linda, you did great. Okay. In fact, just take your time on this. You really take your time. I'm going to watch what you do. Take your time.
Is that comfortable?
Okay, now
Yeah, I
So I
think you're
don't
right
feel like
under
I'm
the
on
clavicle
the
there.
humeral head or anything.
yeah, and I'm going to
No?
tell you, no, you did fine. And I'm going to tell you, if you can, I'm going to do just what I did with her. Really try to get on her rib. There, Linda, is that okay?
Oh, that feels a lot
Doesn't that feel
different.
better?
Okay, yeah.
And then you just take and get a little bit over her. No, you're fine. A little
this
there, a
way?
little over her. There, you got it. Perfect, perfect. Now bring this arm up a little bit, and you got her. You are in perfect
Okay,
position right there.
so-
Linda, doesn't that feel pretty good?
Yeah.
Okay.
So-
And you're going to take the whole body. Don't squeeze hard. Sandwich, and just practice. Don't move this arm. Just practice doing there. Okay, we're ready to go. Okay.
Take a deep breath in. And all the way out.
Impressive. Very good.
Deep breath in.
Good. And at the very end, if you have to let it up, let it up. Blow. Now we're going to keep it there. We're going to stay right there, Carrie.
Okay, and
Stay
deep
right
breath
there.
in.
Stay right there. Good. She's still breathing in. Now out. Good. Good. See what you're doing now right here? Linda, can you feel it? Right through here. Linda, does that feel like about the right amount of pressure for where you're at
Yeah.
right now? I think so. I wouldn't have gone any more than that. Okay. Thank you, guys. Appreciate that very much. How did it feel on the arm that's going up in the air with
She
inhalation?
could have had more traction on the arm.
Absolutely, absolutely. And she's, you know,
If I understand the
I was
technique.
just gonna say, she could have. She's got the process down, but on the air in, you could be doing.
Yeah, I wasn't. I need to practice more.
Of course you do. You guys are awesome. Thank you so much. Thank you so much. We are back on page 45. You guys did a great job in that lab. And as a result of that lab, I had the opportunity to work with a table over here that had an individual that would start to cough a little bit. Coughing and not choking and dying, but coughing is probably pretty normal, right, Mike? You're going to get people coughing. I don't know, Chad, if you've seen that or not, but is Kurt still around? Did he take off? Is he here? Where's Kurt? Okay, but I think Kurt will tell you, you'll start to see people do this. You know, something's choking me. Well, that's esophageal, pharyngeal, that's the anterior digastric, that's the throated self-test of being pulled on. And I always kind of like it. It tells me that we're really getting things to lengthen up. And so I would tell her, Linda, you know, this is normal. In fact, you'll get some coughers. That's a reflex. That's a diaphragmatic reflex. You're stimulating. They're going through a reflex with their diaphragm. And so you'll stimulate that. So you'll see people, Joy, cough, get a little choky, gasp, and, you know, clear their throat. That kind of thing. You'll see that a lot when you do these techniques. It's a really cool thing because you're doing a couple things, not only with the neck, the diaphragm, the reflex, but also you're kind of shedding some stuff off of a pleural lung that's shaking down the bronchial tree, and they want to cough it up. So you're doing the old thing that we did in school, Joy. What do we call that in school? Way back, those seasoned therapists. Rick, what do we do? What did we learn when you and I, way back? Chest percussion. For some reason, we didn't think it was important and kind of let it go. But you're actually doing, didn't you guys feel like, Susan, didn't we do some chest percussion on you today? Yeah. You know, these great pulmonologists and these good pulmonology technologists, these technicians, do a pretty good job of that. So anybody should, anybody can do some of that. And we all should be mindful of that's why you're coughing and choking. Any questions about that at all? Makes sense? You'll see that. You'll see that going on. I want you to go to page 45 to finish this baby up. We pulled it out, did we? No, 46 is where we're at. Okay, after your ZO abdominal non-manual techniques and right superior T4 manual techniques were engaged, all tests are negative. And at that point, what you want to do is a right low trap and right tricep program. And Jen, I really want to keep that to the very end. So I'm going to keep going here, okay? So hang in there with me. If all or some of the tests remain positive, and that was when we did the superior T4 manual technique, the right apical expansion test was minus. You didn't have any problems with it, but Susan, doggone it, that left apical expansion test was still positive. The arrow says we want to do a right subclavius manual technique, which you all just did a great job doing. Okay, then there's an arrow. Now you want to stabilize that spine with a left low trap and a left serratus program. So we want to get the left serratus activity. What's the left low trap do to your thoraco-low spine? Low thoracic spine. It turns your low spine to the right. Well, we're after that. We want that. Now, every single technique in all your manuals will include the right low trap and right tricep. You'll never have to worry about selecting an activity, right, Jen? Every single one's going to have a little right low trap, right tricep in it. We're picking 5 exercises, 5 techniques that have more left serratus and left low trap, following this technique that you'd want to carry out. The full instructions of these techniques are on page 17 of your appendix. If you want to go there, that'd be great. How many do you have, Jen? 5? 5. So she gave you the 5. There are 29 left serratus and left low trap exercise. We picked 5. Okay. Let's pick this one right here. Let's talk about it. How is this left low trap and right arm work? Well, this is a snippet, Jen. If you go to page 17 in your appendix, I probably should do the very same thing, so I know how yours is laid out. Look at her left arm on the middle of the picture. The left arm, Tessa, is moving with the right leg. Don't have to be a physical therapist to figure out that that's thoracic gait. Do you see that? Look at the picture before, the third picture. Which arm is forward, Tessa?
Right.
Okay. So we got the right and the left working. Right and the left working. With the corresponding hip activity that should accompany it. What are you going to concentrate when that left arm goes forward? What are we going to concentrate on? Jen did a good job of it. Thank you, Rick. Say it again one more time for the class. On the left side. That's what you should be concentrating on. Okay? That left serratus is going to pull that mediastinum back. That low trap's going to kick in. Then you go right back on the other side. When you move the right arm forward, what would you be concentrating when you move the right arm forward? What would you be concentrating when you move the right arm forward? Right arm, go forward. That's what I would concentrate on. Get the arm to go forward. What are you going to concentrate on when the left arm goes forward? Left thorax go what? Back. So help your patient with that. Okay, left serratus and left low trap. Both of them have low traps on them. Both of them. Because your opposite leg is moving with it. So you're getting rotation, spinal rotation, with the opposite leg going with it. So they're really cool activities, and therefore you have the right low trap working, and then you have follow-up with the left low trap. Let's look at this gal. This is Anna. Let's look at Anna. How is she getting left serratus here? Left low trap and serratus on this one. Man, that looks like it's a misprint. Jan, did you